Last Wednesday, the Laloki Psychiatric Hospital shut down operations due to reports of hepatitis A, with much of the blame on the continuous use of bore water. Minister for Health and HIV and AIDS made it clear that the hospital will still be on lockdown until clean and safe drinking water is made possible in the facility.
If we connect the water, as it got enough pressure, and where are the taps? Are the underground pipes all rusty or buggered up? So we may have to relook at the full costing. So it's not a simple issue the way I see it. I think this hospital been built long time ago had those iron pipes. Now we have poly pipes, which are the current ones. So I think we may have to bypass that underground systems, but look at new poly pipes put in every office, every toilet, so that there's water running.
Apart from the water issues, there were other pressing issues like the maintenance, upgrading and reconstruction of rooms, ablution blocks and common rooms. The shower rooms and the toilets were in a very bad state, with accumulated stains and dirt on every corner of the floor and walls. For a place where patients go for rehabilitation, the living conditions were very poor and unhygienic.
I'm going to have a 3-year program, and the priority is water, but for water to come in, we need proper sanitary facilities inside, including the toilets. And our psychiatric patients, they don't differentiate between what type of water it is. And so we make sure that those are properly designed.
It was noticed that the Laloki Psychiatric Hospital did not have a board, and in light of the recent event, the hospital is planning on appointing board members that will represent the institution.
I will want to establish a board, because I want the private sector people to come, those who are willing to come and help the hospital through a board system. And so I will be preparing a cabinet paper to have a board in place. Because private sector, as you know, there are many people that have connections everywhere to raise funds, to maintain the facilities. Because there's no board here, so Department of Health is struggling by itself. So I made a commitment myself to establish a board for this hospital.
Sir Puka said after his meeting with the staff, he will sit with the State and Enterprise Minister, William Duma, and discuss the possibilities. He said at this stage, most of the water pipes have been contaminated from the bore water. Therefore, he will have to talk with Eda Ranu and see if they will remove the pipes or put in new ones in place. The minister mentioned that all these things comes with their own cost. Therefore, he will have to assess the possibilities first before bringing clean and fresh water into the facility. Michelle Stephen, National EMTV News.